Welcome, everybody. This is our second Alzheimer's workshop for 2021, and we are very, very happy to have Savannah Levine as our host from the Alzheimer's Association today, and we have Ron Evans as our presenter. And I thank you very much both for being here, and I'm going to go ahead and give the program over to Ron now.
Okay, thank you very much, Melissa. I think Savannah should unmute herself and say hello to everybody so they know
Savannah,
who she is.
do you want to unmute and say, okay, that's fine. Sure. Savannah, would you like to say hello? That would be nice.
Hi, thank you, Melissa. Yes, I'm Savannah Levine, Program and Education Specialist, the Alzheimer's Association California Southland Chapter. Today you're here for Healthy Living for Your Brain and Body. We're very excited that you all are here today. And we have Ron Evans, who is our fantastic community educator, who's going to be presenting today. So I will hand it over back to Ron. Thanks, Ron.
Thank you, Savannah. Yes, I always rely on Savannah to do good introductions. She does them so much better than I do. I am pleased to be with you all today, and we're going to be talking about dementia and Alzheimer's. We're going to be talking about what we can do to be the best we can be by healthy living and looking after our brain and our body. So let's go straight to the next slide. And we're going to try and help you understand some ways in which you can take care of yourself as we get older. If anyone has a solution for not getting older, please let us know. We're all waiting to hear. We're going to talk about physical health exercises and things like that. We're going to talk about diet and nutrition. We're going to talk about cognitive activity, and we'll hopefully mention what dementia is as we go through the program, so you have some understanding in case you missed the last presentation. And we're going to talk about social engagement, and we're actually practicing social engagement right now with this Zoom conference. So as there was conversation in the background earlier, yes, it's wonderful that people can get onto this kind of thing without having to get in their cars, drive. And in the case of Alzheimer's and dementia, we're always aware of caregivers' needs, and caregivers are not always able to get to physically get out to go to meetings. So Zoom has definitely helped them become engaged in learning programs and so on. And we're also going to be talking about kind of how you can develop your own plan. Savannah, did we or are we providing the tips for latest research workbook? Is that going to be emailed to them?
They don't have it as of now, but I can discuss with Melissa and Kathy offline if we're able to get that to them. That would be a nice workbook for them to be able to go through.
Yeah.
Okay,
that'd be great. Yes.
Okay, so let's go to the next slide. And we're going to be talking about what does aging depend on? It's something that we don't seem to be able to stop, but aging well depends on how we handle who we are and what we have. Our genes play a role in this. Our environment plays a role in this, and also our lifestyle plays a big role. Lifestyle choices, we all know, help us either keep our bodies fit, or we do things with lifestyle that unfortunately goes against the grain and doesn't help us stay as healthy as our body and our brain could be. And moving right to the next slide. So we're going to start with the brain and how it works. It is the control center of our body. There's neurons, 1 billion or more, 100 billion neurons, nerve cells that are in our brains, and they magically work together, signals traveling throughout the brain, forming memories for us, controlling our thoughts, controlling our feelings. And feelings in this regard, by the way, is sort of two things. One is the senses that we have, touch and feel. There's that feel, or seeing, hearing, tasting, smelling, but also our emotional feelings. And that controls our moods. Alzheimer's, by the way, is a disease. It destroys brain cells and it causes dementia. Let's go right into the next slide. The heart and the brain are interrelated because the brain requires oxygen, and the heart is what pumps the blood that carries the oxygen into the brain. So what we do to look after our hearts also helps our brains and keeps them. If we choose healthy lifestyle, we are getting the best of both worlds and keeping those two very important components of our bodies in the best shape they can be. So as I mentioned, the brain needs blood flow. Oxygen is required. And in fact, 1/4 of the blood from each heartbeat, every pump of the heart, goes to the brain. The other thing that affects blood flow, of course, are the conditions of our arteries and so on. Now, dementia is a condition. It's a condition I like to use the analogy of it's like a headache. A headache isn't a disease. A migraine is a type of headache. Alzheimer's is a cause of dementia, which is when we lose our abilities to do things that we used to be able to do. And what do we mean by losing our abilities? Well, that's just about anything and everything that our bodies do, because everything's controlled by the brain. And an example of dementia, which is not caused by Alzheimer's necessarily, but a situation of dementia might be that somebody loses their memory because of concussion, and they may recover that memory, their ability to memorize things and go back to normal functioning life after a period of time. Dementia in itself is not necessarily part of normal aging, but it appears to be to a lot of people because we slow things down. Things slow down as we get older. But in the case of a disease like Alzheimer's, that is definitely not just part of normal aging. It's something that we're either fortunate enough to avoid or we're not, just as avoiding cancer would be something we want to avoid. But Alzheimer's disease is the most common cause of dementia, especially when we talk about dementia that cannot be controlled, cannot be reversed, cannot be stopped, and unfortunately can't even be prevented and cannot be cured. The known risks for Alzheimer's begin with age. Most people who experience dementia to the level that it impacts their daily lives are elderly people, people over 65, people in their 70s, 80s, and so on. But there is a category of Alzheimer's disease that does affect younger people too. We call it early onset. And that early onset Alzheimer's can affect people in their 50s and even their 40s. So then we talk about genetics. We can't control our genetics. We have them from birth, just like you're either born male or female, for example. And the genes that we have can today be screened, and we can determine whether you have high risk factors or lower risk factors. But even if you don't have what people refer to as the Alzheimer genes, doesn't still guarantee that you won't get dementia. Head injuries cause dementia. Sometimes they're reversible, the effects are, such as concussion, but repeated head injury in particular, and head injuries in later life, when we're older, quite often are not reversible and lead to traumatic brain injury levels. As I mentioned earlier, cardiovascular, as in the heart and the related pipes, the arteries, they're all factors. And the condition of them when we reach our 60s and 70s was usually determined by what we did in our 20s and 30s, or maybe even in our teen years. And finally, on that list there in that paragraph is formal education. People who have had formal education and maintain formal education tend to avoid dementia better than people who don't seem to have had a a high level of formal education. Therapies for Alzheimer's, we hear about there are some drugs that are available for people who have been diagnosed with Alzheimer's disease, but those drugs simply help to handle the condition. They help to handle the problems that are associated with having dementia. They don't cure the dementia, they don't prevent it, and they don't even really slow it down. It may appear to slow things down and plateau, but then it usually, when the drugs become less effective as things go along, then it looks as though you get a rapid deterioration. So the progression of the disease, unfortunately, we don't have ways to stop it. We just need to find a way to prevent it from ever occurring, but we don't have that yet. Let's go to the next slide. So we're going to talk about taking care of yourself. You could say, it says on the slide, as you age. Well, taking care of yourself can start anywhere. It can start when you're in your childhood. It can start when you're in your teens. And if I mention something like diabetes, we can all relate to eating junk food and everything else that we shouldn't be eating when we're young kids. And some of us end up with diabetes, obesity, and problems like that. But of course, let's recognize that our genes also make us susceptible to challenges like that in life. In this circle, we've got 4 quadrants: physical health and exercise, social engagement, which we're already talking about here, diet and nutrition, and cognitive activity. So let's go to the first quadrant, which is physical health and exercise. And this is going to lead us to a video that is going to introduce, we're going to introduce some people to talk to you, so you don't just have to listen to me. So cardiovascular activity does help in reducing your risk of cognitive decline, partially because as I mentioned earlier, the better the blood flow to the brain, the better the brain can function. Regular and vigorous exercise increases the blood flow when you get your heart rate going. And so doing things that, physical things that increase your heart rate, even for a short period of time each day, really benefit you. But there is no single recipe, there's no silver bullet. Let's go to the next slide, which is introduction of Woodley, and he will talk to us about his exercise challenges.
It's surprising how you can easily build up habits of just taking 15 to 20 minutes out of your day to go down, hit the treadmill, and just do it. Just do it. Just get on it, put my headphones on, and just walk at a nice brisk pace for myself, build up a quick heartbeat, quick sweat. And it's amazing how quickly I can go from 15 minutes to 20 minutes. And then over time, 30 minutes, and over time, 40 minutes. Before you know it, you're up to 45 minutes of walking, and even at a higher incline and also at a higher pace. And again, it's all about incorporating habits and the choices that we make.
So Woodley talked about his own habits there, his own challenges. But the thing is that he is somebody who still has enough physical fitness ability to get onto a treadmill. And that's not the case with many people who suddenly find that they're faced with dementia, because they may have physical limitations. And so they've got to look for other things that they can do. So what we can do is to look for things that are within our physical ability, things that are things we like to do, and you should start out gently. Don't try lifting heavy weights to begin with. Lift small weights, for example. The goal is to find anything that you can do on a regular daily basis that will get your heart rate increased. There's something you could do right now, every single one of you, without moving from your armchair or wherever you're sitting. And that is to take a deep breath. Go ahead and take a deep breath. Inhale until you can inhale no more, and then exhale, let it all out, until you can't expel any more air. Repeat that. Inhale again and exhale again. And inhale again and exhale again. So we just did that 3 times. If you do that 3 to 5 times, a couple of times a day, you're already doing something that pumps more oxygen to the brain than doing nothing. So getting your heart rate up, increasing your blood flow is a basic for us. If you can get involved with a group, joining you, it says ask your friends to join you. If you can join an exercise group of some kind, doing something that you like, that's great, because you're then holding each other accountable, and also you're already in another quadrant, which is social interaction and social activity. And yes, you can do that on Zoom as well. You don't have to physically be in the same room. Okay. Now, our final caveat on this slide is you need to do things and have your doctor know what you're doing. And I'm assuming that everybody is way past 29 years old that's on our call here today. So make sure your doctor kind of gives you the okay. Make sure they check you out before you get started, and they might give you some pointers and suggestions as to what would be appropriate for you. So moving to our next slide, what we can choose to not do, and that is let's quit smoking if we smoke. If you're drinking too much, and by the way, alcoholism amongst elderly people is an epidemic. It actually is a real problem. So drinking moderately is good and healthy, and just make sure you're not drinking excessive. Brings about depression, by the way. Adequate sleep is required, and that becomes a challenge to everybody, it seems, who's in their 60s and 70s. Avoiding head injury. Okay, so we show a picture of somebody choosing to get out on their bicycle. I'm impressed and amazed by how many elderly people I actually see riding bicycles these days, and I'm pleased to see that most of them are wearing helmets. Only a few choose to not wear helmets. Doing anything we can to manage stress is good and helpful. Breathing exercise helps manage stress. Just when things stress you out, just breathe deeply a few times, and you've just accomplished something for your stress and also for your brain. And make sure if you have any hints of depression, if you're just not feeling who you like to feel to be, get help. Visit you with your doctor and ask for referrals. One of the things I like to say about doctors, or ask in real life presentations when we're all in the same room, when we used to all be in the same room, was to ask people to raise their hands if their doctor was somebody that they've been with for at least 10 years. And most of the hands would go up. And then you ask what about 15 years? What about 20 years, 25 years? And the hands would still stay up. Well, those doctors were not gerontologists. So you need to be asking for referrals these days from your doctor to either gerontologists or to neurology specialists. Let's go to the next slide. And here we have doctors, or somebody at least medical, helping us to monitor our blood pressure, our blood sugar, our weight, our cholesterol. Do those things on your own. You don't have to go to a doctor and only rely upon the checkups that they do when you visit. Obviously, if you're somebody who is challenged with diabetes, you're going to be checking your blood sugar, I should say. And as far as weight and cholesterol goes, those are other major things to check on and track. Let's go to the next slide, and we're going to move on into what contributes to all too often to those numbers not being as good as they should be: diet and nutrition. So what we eat, what we drink that's good for the heart may also be good for the brain. Nutritious food is fuel for the brain. So getting some dietary guidelines from your doctor. You can turn to the Alzheimer's Association if you have relationships with other organizations where diet and proper healthcare planning is part of the program. Usually they have got dietary guidelines available. The only thing I'm going to mention here is simple plan like the Mediterranean diet. When you think of in terms of your food, when you think in terms of the food on your plate, half of your plate ought to be vegetables, and less than a quarter of your plate should be meat, and the rest would be things like rice and other starches, potatoes, and so on. And we're talking about the same kind of programs that the Heart Foundation will be talking about, the Cancer Foundation, the Diabetes Association, Parkinson's disease, Alzheimer's disease, and strokes. We're all on the same page when it comes to what kind of diets we should be doing. And we're not talking about the kind of diets, fad diets that you see advertised on TV for rapid weight loss or anything like that. It took me 3 years to get to my doctor's goal. I call it my doctor's goal because it was really not my goal initially. But at over 200 pounds, 200 and some pounds, he said, it's time for you to do something about this. And I'll tell you now that I feel a lot better for being about 50 or actually 60 pounds lighter than I used to be. So let's move on to the next slide. This is Martha, and she is with the Rush University and very heavily involved in nutrition.
Foods that have been shown to lead to healthy aging would be fruits and vegetables.
Can you go back and replay the video? Thank you.
Foods that have been shown to lead to healthy aging would be fruits and vegetables, and in particular green leafy vegetables and berries, as well as limited intake of high-fat food items that you get through high-fat dairy and cheese and red meats, and also healthy vegetable oils. So this would be olive oil would be a good example, have been shown to reduce your risk of heart disease as well as dementia.
So what we can eat, what we should eat, vegetables, green leafy vegetables were mentioned, fruits, including berries in particular, because they're good antioxidants, nuts, beans, legumes, including peanuts, and whole grains are all good for you. Lean meats, fish, poultry are better for you than red meat, but you're allowed red meat under the Mediterranean plan once every couple of weeks or once a month. And using healthy vegetable oils and olive oil, as an example, are the right choices. Should point out that there might be people out there like me that have some allergies, and so certain things are not on our list. I don't have anything to do with garlic, and I don't have anything to do with peanuts. What we should avoid, and you can read labels on all the foods that you purchase, saturated fats and trans fats are bad for you. And if you want to have a way of remembering which are the good fats, look for the unsaturated fats. It begins with the letter U, and they're good for you. Processed foods need to be avoided. There's too much fat, sugar, salt in all of those things, preservatives. Keep those to an absolute minimum. And yes, we have to really probably push aside as much as we can of deep fried foods and limit ourselves there. Unhealthy fast foods are, as they say, unhealthy. Let's move to the next slide. We can add dietary supplements. And I'm going to say, I'm not a doctor, by the way. I'm not a medical or a clinician person, but I'm going to say, get good advice. And good advice comes from generally real people rather than just Dr. Google. But if you do your research thoroughly, yes, you can find a lot of good information out there on the internet. And I'm sure that Glendale Adventist medical advisors will point you in the direction of websites that they would trust. Later, we're going to point you in the direction of the Alzheimer's website as well, which, of course, we trust. So involve your doctor. He's part of the team. Work with them and make sure that dietary supplements and vitamins are within recommendation by your doctor, because you may think you need 1,000 milligrams of something, and you might just be very, very wrong about the quantity you need. Let's go ahead and look at the next slide. So this moves us into the next quadrant, the fourth quadrant, which is the brain, our cognitive activity brain quadrant. So in here, next slide, thanks. We're going to be focusing on, well, what happens here within the brain. Earlier we had a kind of diagram of the brain showing a branching network as they described it, and your active mind, your mind's activity creates the active network that you need in order to function as a person. As I'm speaking, my brain is working overtime, trying to remember what to say and organizing things so that they come out right. Cognitive activity actually encourages blood flow, and it takes care of everything for you as far as the brain is concerned. Mentally stimulating activities also cause activity in the brain, which it helps further to improve blood flow. Today, you can have scans done which show in radiant colors which areas of the brain are active, which ones are operating effectively for you, and which ones are looking like they're dormant. So today we have a lot better way of knowing what's going on in our brains if we take advantage of any and every scan and check out that's offered to us. Formal education is a good challenge for school children. It's a good challenge for adults too. So it will keep your brain healthy, and anything that you're doing that is challenging the brain is actually helping to provide extra protection against aging and against developing dementia. Even if the dementia is in your system because of a disease like Alzheimer's and you're destined for that path, it still is worth investing your time and effort in trying to push it back as far as you can. Let's go to the next slide. And this is Dr. David Bennett. He's a director with the Rush Alzheimer's Disease Center in Chicago.
One of the most interesting factors is cognitive stimulating activities, which basically for us just means mental processing of information. It can be from a book, it can be from the radio, it can be a magazine, it can be from a lecture, it can actually be from watching TV. All of these things require processing information. And the old adage of, use it or lose it is actually something that turns out, at least from the observational data, to look like it's true. So numerous studies now have shown that being more engaged in cognitively stimulating activities is actually good for maintaining cognition. And it's true in late life, and it's true in early life. And so what we recommend is that you start early, and if you're already late, start now.
Okay, so reading books and articles is a good starting point. Exchanging those for TV programs, although there are TV programs that will challenge your mind, and those definitely can be part of the plan that you put together for yourself. We've heard about doing crossword puzzles and oh boy, I've forgotten the name of that puzzle with the numbers. It'll come to me later. I've learned to relax when I can't think of a word, and usually it just pops into my head a little bit later on. But doing anything that is enjoyable and challenging is a good way to go. Learning new skills, new hobbies, and engaging ongoing learning. And thank you, Sadika, for reminding us. It's Sudoku that I couldn't remember. So I'm on the same journey as many of you might be already as well. So let's move to the next slide. And that is social engagement, which is our last and fourth quadrant. I think I misnamed the other quadrant incorrectly previously. So social engagement, getting involved with all the activities you can with other people. So here we are on Zoom, engaged in something where hopefully we're challenging you a little bit. And as the doctor said, people who are doing things and stimulating their brains, increasing their cognitive activity, are reducing their cognitive risk. And so living longer with fewer disabilities. And this is a reference to disabilities coming about because you lose your abilities. With my own mother, who is now 93, the first thing that I really was aware of was the fact that she shortened all the telephone conversations that we had because I'm in a different country to her. And secondly, the messages that came with my birthday card and Christmas card were getting shorter and shorter to the point where it was just happy birthday or Merry Christmas. Those were the two things that, with hindsight, our family recognized were the early indicators for my own mother, for our own mother's dementia developing. Staying engaged with the community is great because it can get you up, it can get you out. Of course, that was easier before COVID. Hopefully, we'll be back to the point where people can get back out into the community. But we've also learned there are some positives from becoming knowledgeable about how to use Zoom, for example. And anything you can do that keeps you socially and mentally active is very helpful in supporting your brain health, and it's active is also helping your heart health. So it's a win-win situation. So we can go visiting with our friends and family, provided circumstances these days allow it. Engage with others. I haven't mentioned social media, but some people have found social media to be very helpful. It can also, unfortunately, be very depressing when you realize that all the news is bad news and nothing is good. But staying involved with your community, building your own community, which depends upon where you live and what might be available to you locally. And wherever possible, why not volunteer? When you volunteer, you become part of an organization, become part of a team, and you also get to meet a lot of other people in the process. So joining any kind of organization, group, or club, including things like YMCA, swimming clubs, and things like that, which give you a physical exercise component. Silver Sneakers memberships at YMCA and other gyms and so on, for those that are physically capable of handling that. So let's move on to our next slide, which takes us to put everything together. And we got to get moving, get up, get moving, eat right, keep your mind active, stay connected with others, find new ways of getting connected with others, find new ways of making your mind active. Yes, experiment in the kitchen, cook more, and use processed foods less, things like that. Doing all of these things helps you to have a plan that's going to help you stay as healthy as possible, sleep better at night, and everything else. And where does that lead us to next, Savannah? To Dr. Thies. Thank you.
Recently, at the Alzheimer's Association International Conference, there was a study reported of the results of a large clinical trial that was done in the Scandinavian countries. And in this trial, they took half the people in the trial and they adjusted their exercise level, their diet, their social engagement, and their mental stimulation. They developed programs for each one of those variables, changed all of those for the people that were in the test group, and the control group just lived as they had been. There is a tremendous benefit to doing studies where we make changes and observe after the fact. That's a much stronger study than just observing people and trying to make judgments after life has changed for them. To my mind, one of the things that this has done is it's changed the force of recommendation that we might make around the benefit of these interventions for prevention of Alzheimer's disease or for brain health. And the fact is that I think it's moved it from possibly exercise, diet adjustments, social engagement, mental stimulation are useful, to probably. And that's a big change and makes it easier for people to make those kinds of adjustments for the benefit of their future health.
So Dr. Thies there is referencing a study done in Scandinavia. I believe it was done in Sweden. Sweden is a country that has a population probably very close to the same population that we have in California. And yes, they are the idea of research and finding the funding for research is a major reason why the Alzheimer's Association exists. What each person can do for themselves is to find programs that they can develop for themselves and develop with others, and start out at a level that's comfortable and build from there. Find things that you enjoy doing so that you will stick with it. And in the kitchen department, in the culinary department, make healthy choices. And generally speaking, just put together your own personal plan. And whenever you can engage with others and get support from others, that simply helps people stay on plan much, much better than if you're trying to do it in isolation. And choosing things that are fun means that you may have fun. So now move to the next slide. Thank you. So there's a lot of stuff that's out there in the media, on the internet, on the TV, and so on, advertisements with big claims. So our message here is, when you hear about these claims, you should be very cautious, because those claims are probably not true. Miracle cures will be supported by and endorsed by the Alzheimer's Association if they're properly proved to be. So if you can't find an endorsement from a major organization like Alzheimer's or Diabetes Association or the Heart Association, something like that, it probably is not really something that you want to put a lot of faith in and a lot of money into. Do your own research and trust your doctor. Ask your doctor to, however, introduce you to specialists who are appropriate to looking after elderly people, neurologists and gerontologists in particular. There's a reference here to the pharmacist. One of the things I like to point out to people is, when you go to the doctor's office, you should take all your drugs with you. That is to say, all of your prescription medications should be in one Ziploc bag. All of your over-the-counter medications should be in a separate second Ziploc bag. And in a third Ziploc bag, you should have any vitamins and supplements that you might be taking. Show those to your doctor. Show those to your pharmacist. Because one of the biggest reasons for people, elderly people, ending up in ER is medication mix-ups. And medication mix-ups, by the way, can quite often cause things like memory loss. And so people go around saying they're losing their memory, they must have dementia, it must be Alzheimer's, when in fact it's something that can be resolved simply by properly sharing all the necessary information about what you're taking. When elderly people get referred to specialists and they get offered or provided with a prescription by that specialist, there are many cases in which your own doctor doesn't find out about what was prescribed because of something called HIPAA. So know what you're taking and share that information with your doctor, with the pharmacist, and have them see if there are any conflicts with regard to the medications you're taking. And now we're going to talk about the Alzheimer's Association. So move to the next slide. And I'm going to hand over to Savannah, who's very patiently waiting to tell you all about what we do and how we do it and how you can benefit from it.
Thanks, Ron. So I am here to talk to you about our care and support resources for you. So on the left, you see that there's alz.org. So that's our website, and you can find so much information on this website. There's an entire section dedicated to caregivers, to those who are affected, for also professional resources. There's a safety center, so that, dedicated to wandering, or when to stop driving, those types of resources. ALZ Connected is for those who are caregivers who want to connect with other caregivers across the country in chat threads. There's also chat threads for those with Alzheimer's, so that's a great resource. The Community Resource Finder is a resource where we partner up with AARP, and by zip code, you can find in-home care or an elder law attorney or pretty much anything, a neurologist. It's an incredible resource, and it's all embedded within our website, alz.org. So go ahead and check that out. I always say use the search feature because it is so extensive, but it has so much information. So check that out. Also, we have our helpline, the 24/7 helpline, that 800 number there at the left bottom there, 800-272-3900. I always say, take this number down, put it in your phone. You never know who's going to need it, whether it's yourself, a family member, a friend. Anyone who's affected by the disease can call, whether it's a family caregiver, professionals asking for help, the person who's affected by the disease directly. It's in over 200 languages, and day and night, 365 days a year. So you really can't go wrong. And if you're looking for more local referrals, you can always, basically the helpline will reroute you to talk with someone at the local level. So you can always get to our local staff or call us directly. And I'll be happy to do what's called a case consultation and do referrals in that way. So lots of opportunities. We also have support groups for both those who are family caregivers and those who are affected in the early stage of this disease. And we have education programs all virtually right now. Of course, we used to have them in person, and we'll probably eventually transition to a hybrid where we, similar to what Melissa was talking about, eventually we'll have in-person opportunities as well as virtual opportunities. We still are not offering those in-person opportunities at this time. So everything is virtual, but we do have those support groups. We have early stage engagement programs, which are partnerships with, we have virtual museum tours with the Hammer Museum out at UCLA, with MOA, which is the Museum of Art and History. We have gardening and magic and all these different programs for those to have a peer-to-peer experience, even coffee and conversation, so just a socialization type program. Below that, we have our training, our on-demand. So right now you're receiving sort of a live workshop with Ron, but we do have all our trainings on training.alz.org, our on-demand education. So you can always check that out and see all our core programming. But we will be having another training workshop here with the Live Well Senior Program next month. So I'll tell you about ways to get involved. So Ron, I always like to sort of give the example of people who are already on the call. So Ron is a volunteer. He's a community educator of ours, wanted to get involved, and he's been a wonderful asset to our team. We really treat our volunteers like our partners in this, and it really is a partnership because they raise awareness, they educate you and really support the mission. So you can volunteer with us in many capacities. You could become and someone. Yeah, someone muted me. That's interesting. Okay, you can hear me though, right?
Yes, can now.
Okay, fantastic. So you can actually become a support group facilitator. You can become a community representative, which basically just means you're a liaison for us out in the community. Right now, everything is, again, virtual opportunities, but we used to have health fairs and those types of different things where you could use our resources and represent us in that way, or to community groups. You can join our Walk to End Alzheimer's Walk Planning Committee. So we have a San Fernando Valley walk, and we also have a Santa Clarita walk, and basically walks all over, actually. So wherever you are, we've probably got a walk that's near you. So you can go to alz.org/walk to find how to register, but also to get involved with your local walk planning. We're always looking for volunteers. So the longest day is a really unique opportunity. You probably see my background, and I'm highlighting the longest day because it's sort of like the stepsister and doesn't always get as much attention. And so I want to highlight that you can do something really creative to raise funds for the Alzheimer's Association. So I'm actually doing a virtual cooking class and asking for donations that way. You might have a hobby where you knit things and you can ask for donations for something you knit. You could do a fitness class. It really goes on and on of the ways that you could support the Alzheimer's Association through the longest day. So you might want to look into that. You can also become an advocate. So we have an entire arm of the Alzheimer's Association that's dedicated to advocacy. It's called AIM, AIM, and it's a way to advocate on behalf of those who are affected by the disease at the state level, at the local level, federal level. We have a federal policy days coming up. We had state last month, so it's been a very busy season for us, and we're getting a lot done on the policy level. It's a very exciting time with the Master Plan on Aging in California. So highly recommend that if you are politically focused. And then we also have Trial Match. So Trial Match is a way to get involved with a free clinical studies matching service. And the way they do that is ask questions about you. You get paired up, and you don't have to accept it. They'll give you some choices. It used to be by zip code, but a lot of the opportunities are virtual now, and you don't have to be affected by the disease. Some of the criteria may be looking for a healthy volunteer, maybe a caregiver. So it really depends on the criteria of the specific study, and not all of them are pharmacological. So not all of them involve medication. It could just be about lifestyle or different factors. So please look into that if you're interested on the research side of clinical studies. There's so much opportunity to get involved. So those are the ways to get involved. So with additional resources, Ron hinted at some of these, getting involved in your YMCAs and local health clubs, really getting into that fitness. Of course, we know everything is shifted because of COVID, but just like here, they may have opportunities for virtual classes. I just don't know. Same with senior centers. It depends on the senior center, what they're doing right now, and your local area on aging. So at least you can ask the questions and see what they are up to. Some other resources for you might be the NIH, so the National Institutes on Health have lots of information on aging and what's on your plate, Go for Life, all these different programs, Brain Health as You Age from the Administration on Community Living. Of course, the CDC, we all know the CDC now. But the CDC doesn't just work on COVID, they work on all things public health. So please look into the CDC for recommendations on health and nutrition, physical activity. They have all the good guidelines there. So lots of opportunities to inform yourself. So now Ron and I will stay on for some questions. I hope you do take down the helpline and our website. And we love questions, and I'm going to be able to get the basically the work plan. It's like a workbook to be able to plan out what you're going to be able to do for your health, and get you our calendar, our monthly calendar of programs and early stage opportunities and support groups. Hopefully Melissa and Kathy will help me getting that out to you. So we're very excited that you're all here today, and I know there's lots of you. So hopefully you can put your questions in the chat or go ahead and unmute yourself, but we'd be happy to answer any questions on anything that we mentioned today.
So I see in the chat there's a question about cardiovascular factors is included, heart attack.